Oh, hi. Welcome back to this episode on exams, university exams made easy for first MBBS professional exam. We have discussed about the topics that are very frequently asked in head and neck, neuro, and other major topics. So today, what we'll be doing is today we'll be talking about the most frequently asked topics from the section of abdomen. Now, abdomen in most of the universities, irrespective of in which university you are, uh, the marks allotted to abdomen and pelvis, right, is almost close to 45 to 50%. So in a paper of 100 marks, 45 to 50 marks will be from abdomen and pelvis. So what we'll do is we'll focus on the abdomen topics today, and next Monday we'll be focusing on the most frequently asked topics from the section of pelvis, right? So as we have done over the last few weeks, let's try to begin with the most frequently asked topics from the abdomen, and we'll also see some of the questions that were asked from like some of the university exams, the actual questions, right? So first, let's start with the topic of osteology, right? What were the most frequently asked topics from the osteology of abdomen? Now, here we expect very few questions, and some of this actually overlap with the topic of the lower limb. The first question I want to point out is the question from the sacrum, right? In the entire topic of lumbar vertebrae and the sacrum, we can expect a three-marker question on the ala of the sacrum. The structures related to the ala of the sacrum, a very important three-marker and also an important spot a question for your practical exam, right? We know that we can remember it using the mnemonic oils, right? From lateral to medial side. So structures related to ala, an important three marker. Then what is sacral canal and its contents? So you need to define what is sacral canal, and you need to list what are the contents present in the sacral canal. Okay, so this is one important question that we get from the sacrum. These two questions can be part of the lower limb paper. Again, in most of the universities, abdomen, pelvis, and lower limb, they actually come in one single paper, right? The ischial tuberosity with the muscles attached, right? So this is again a three marker. So even sacral canal is an important three marker. Greater and lesser sciatic foramen are again three marker questions. So hardly any five markers in the topic of abdomen. Of course, in pelvis we will have, but in abdomen, these are the expected questions from the topic of the bones, right? So ischial tuberosity, the main questions will be on the muscle attachments, right? As I said, this is more likely to be a part of the lower limb question, but doesn't matter. Lower limb, abdomen doesn't matter. Ischial tuberosity we should know, right? Uh, how do we divide the ischial tuberosity into different areas, triangular, quadrangular, and which part of these quadrangular or triangular area will give attachment to muscles? What muscles are attached here, right? So that is regarding ischial tuberosity. Then the greater and lesser sciatic foramen. What are the structures that pass through the greater and lesser sciatic foramen? Of course, we had discussed this when we had discussed the topics of the lower limb, how these two notches are converted into foramen, and what are the structures that actually pass through these foramina, right? So these are very important questions that can come from the topic of the bones, right, in the abdomen section, right? Now, apart from this, the next topic, right? What is the next topic or what next chapter we have? The next chapter is the chapter of the anterior abdominal wall, right? Now, in anterior abdominal wall, these are the commonly asked topics. The transpyloric plane is an important five marker, okay? Now, as we know, this is also called as what? The Addison's plane, right? Now, what are the things that we need to know or write in Addison's plane? Of course, we need to define what it is. we need to mention about how to mark the plane, right? How to mark the plane, and then what are the important anatomical events, right? What are the important anatomical events that occur at this level? One line you can also add is, apart from the mark, what is the vertebral level, right? At which vertebral level does the transpyloric plane lie? Is it clear? So we know that the transpyloric plane lies in the midway between the suprasternal notch and the pubic symphysis. And when we draw the transpyloric plane using this method, it usually passes through the lower border of L1, where number of important anatomical events occur. What are the important anatomical events? This is where the pylorus of the stomach lies. This is where we have the formation of the neck of the pancreas. This is where we have the origin of the superior mesenteric artery. This is where we have the uh, end of the spinal cord or the conus medullaris, right? So these are some of the important events that occur at transpyloric plane, and this could be an important phi marker. This is also a very important surface marking topic for your gross anatomy practical exam, right? Then layers of the anterior abdominal wall could be a three marker question just to list, right? The question can be on list the layers of anterior abdominal wall from superficial to deep. So you should know how to list it from the skin till we reach the parietal layer of peritoneum. What are the 8 layers, right? So this is possibly a 3 marker question. That's it. But umbilicus would be a very important 5 marker question. Okay. Now what we will write if umbilicus is asked? Okay. The first thing is, of course, the definition, right? Where exactly the umbilicus is present. Okay. One. Then what is the significance of umbilicus, right? And when we talk about the significance, what is the anatomical significance, right? What is the anatomical significance of the umbilicus? What is the embryological significance, right? What are the embryological folds that are attached here? And then, of course, the clinical, right? What is the clinical significance of the umbilicus, right? So a very important 5 marker in the topic of the abdomen, especially the anterior abdominal wall, right? Then the muscles of the anterior abdominal wall. Now, in the muscles of the anterior abdominal wall, we will have, of course, these 3 muscles. What are they? One is the external oblique, the internal oblique, and the other one is the transversus abdominis, right? So this could be a very important 5 marker question, right? You need to describe the attachments, then innervation and actions of these anterior abdominal wall muscles, right? The chances are less, but it is there. Okay. The 3 muscles, it's better to learn in detail about the attachments, innervation, and actions of these muscles, right? Then the next important topic is the conjoint tendon. Now, conjoint tendon is actually formed by fusion of what? It is formed by the fusion of the transversus abdominis muscle and the internal oblique. So if this question is asked, how would you approach the question? Okay, this again is an important 5 marker, or let's say a 3 marker. Now, if this is asked, you can start with what exactly it is, right? So conjoint tendon refers to the fused tendon formed by the fibers of internal oblique and transversus abdominis. Now, conjoint tendon, what is its function? If it's a 3 marker question, mention how it is formed, what is it, how it is formed, then talk about the function. Remember, conjoint tendon is responsible for strengthening of the inguinal canal posterior wall. The posterior wall of the inguinal canal, as we know, is formed by the fascia transversalis on the lateral side, and it is strengthened on the medial side by the conjoint tendon. And we need to mention this as one of the specific functions of the conjoint tendon. If it is a 5 marker question, For 5 marker question, we need to describe the attachments of both the muscles. So if it's a 3 marker, define what it is, mention the muscles forming it, and then mention its function. Right? If it is for 5 marks, then define it, mention its formation, then describe the attachments, innervation of the two muscles that forms it, and then talk about its function. Right? Then one more important question here, which is like a 3 marker, is the cremaster, could be an MCQ also. Cremaster and cremasteric reflex, right? What is cremaster muscle? What is its innervation? What is its function, right? So the question on cremasteric reflex is more likely than the question on the cremaster muscle itself, right? Cremasteric reflex will again come in handy when we learn about the anatomy of the inguinal canal. We have something called as the ball valve mechanism, right? So what is ball valve mechanism? How do we explain the occurrence of ball valve mechanism? It is nothing but the cremasteric reflex, right? So this could be a very important 3 marker question, or in MCQ, right? What they can ask about the cremasteric reflexes, what is the peculiarity of the afferent limb and the efferent limb? Remember, in both afferent and efferent limb, one nerve is common, and that is the genitofemoral nerve. Remember, the afferent limb is formed by the femoral branch of the genitofemoral nerve, whereas the efferent branch is formed by the genital branch of genitofemoral nerve, which actually supplies the cremasteric muscle. Are we clear? So this could be a very important 3 marker or a part of the defense mechanism of the inguinal canal, right? Then rectus sheath could come as a 10 marker question, but it is more likely to be a 5 marker question. Okay. Now, if rectus sheath is asked, how would you approach? Define what is rectus sheath, right? Then discuss about the formation, right? And in formation, we have the formation of the rectus sheath, which differs at 3 levels: above the costal margin, between the costal margin and the arcuate line, below the arcuate line, right? So how exactly the anterior wall is formed, how exactly the posterior wall is formed, right? At these 3 levels, this is what we need to write in formation. Then the next important subheading here would be to list the contents, right? Now in contents, again, what are the muscles that are there? What are the arteries that we have? What are the nerves we have? Right? So this is how we can structure it. And then of course, the last one is regarding the clinical anatomy. Now, if it is asked for 10 marker, then describe the details of the rectus abdominis muscle and the pyramidalis muscle in detail. Fine, if it is a 10 marker. Otherwise, these headings are sufficient. Done. So rectus sheath, definition, formation, contents, and then the clinical anatomy. This is how you should approach the answer to rectus sheath. As I said, this could be a 10 marker or a 5 marker, but more or less, it is often asked as a 5 marker where you don't have to talk too much about the rectus abdominis muscle and the pyramidalis muscle. Done? Right. So this is regarding the anterior abdominal wall. Right. Then the next important chapter in the abdomen is the inguinal region. Now this is where we can expect a lot of long essays, a lot of short essays, and even short answers, right? Now the most important question here, right, is the anatomy of the inguinal canal, right? So this is a very important long essay, right? A 10 marker or could be 15 marker in some of the universities. Now, inguinal canal is a very commonly asked question, which is used for framing case-based questions. Okay. Let's imagine the question is something like this. You have a 20-year-old male who presents with a swelling in the groin, and the swelling appears or it becomes prominent or on cough impulse, they might even give the coverings of the swelling, and then most of the universities will give the diagnosis. Okay, so this case was diagnosed as, let's say, direct inguinal hernia or indirect inguinal hernia. Discuss the mechanisms which prevent the occurrence of inguinal hernia. Describe the normal anatomy of the inguinal canal. So this is how the question is usually framed, right? They give a case history of either direct or indirect inguinal hernia, and I will ask about the anatomy of the inguinal hernia. Now remember, here in inguinal canal anatomy, if they're giving a case of inguinal hernia, if it is old age, it is more likely to be direct inguinal hernia case. If it is of a young age, right, it is more likely to be indirect type. But if this is asked as a 10 marker, usually, and if no headings are given, what we need to do is we need to discuss about what exactly is inguinal canal, right? Then we can talk about the measurements briefly. Some of the examiners or your evaluators are obsessed with the length of or the size of the normal anatomical structures. Okay, inguinal canal is a 4 centimeter intermuscular passage. That 4 centimeter catches the eye of the examiner. Okay, anal canal, when we discuss the pelvis, we'll talk about it. Anal canal measures about 3.8 centimeters. They're very particular when they see these questions where the length is given or the size is given so much importance. Okay, definition, measurements. Then we can even talk about like where exactly it's located. Then we can talk about the boundaries. Right. Now in boundaries, remember, I want you to write the boundaries under these headings. So first we need to talk about like what is the inlet, then what is the outlet, then what about the anterior wall, then what about the posterior wall, then what about the roof, and how about the floor. What structures form these boundaries? Most often, what the students forget is to write about the inlet and the outlet, which is formed respectively by the deep inguinal ring and the superficial inguinal ring. And most of them end up writing the anterior wall, posterior wall, roof, and the floor, right? So this is where you can score over others, right? Inlet and outlet. And one more thing I want you to remember here is when you write the answers for inguinal canal, please talk about the triple relation. Okay, now triple relation of what structure? Remember, triple relation of the internal oblique muscle. What do we mean by triple relation? Remember, the internal oblique will form the anterior wall, it will form the roof, it will form the posterior wall of the inguinal canal. Right? Now, this is again something that will catch the eyes of the examiners. Okay, you write it, you highlight it, and this is what will help you score marks, right? And then once we have talked about boundaries, we can talk about the contents, right? And in contents, again, I want you to remember, write it separately in case of males and in case of females. Now, if you want to divide it into partial content, then the complete content left to you. What do we mean by complete content? Complete content is something that traverses throughout the length of the inguinal canal, and that is spermatic cord in males and round ligament in females. Now, what do we mean by incomplete or partial content? The ilioinguinal nerve. The ilioinguinal nerve actually pierces the posterior wall of the inguinal canal and then enters it. Okay, so that is what we need to write in contents. Now, once we talk about the contents, then we need to talk about the defense mechanism. Right? Now, what is the defense mechanism of the inguinal canal which prevents the occurrence of inguinal hernia? Right? The ball valve mechanism, the flap valve mechanism, the shutter mechanism, the guarding mechanism, the obliquity of the inguinal canal, right? The intra-abdominal pressure. So all these which actually prevent the occurrence of inguinal hernia in normal individuals, we need to list. And then of course, the clinical anatomy where we need to talk about the inguinal hernia, and it's two types, direct and indirect. At least we should be able to define what do we mean by direct inguinal hernia. Direct inguinal hernia is something that enters through the posterior wall of the inguinal canal. Indirect inguinal hernia is something that enters through the deep inguinal ring, traverses the inguinal canal and comes out of the superficial inguinal ring. Right. Now, what are the differences between the coverings of the inguinal hernia? Now, again, please mark this topic. So, coverings of the inguinal hernia, right? How do you differentiate between the direct and indirect inguinal hernia based on the coverings? This could be an important 3-marker or a 5-marker question. Done. They will not ask you about how to differentiate between direct and indirect inguinal hernia, right? The question would be more likely on how to differentiate indirect and direct inguinal hernia based on the coverings of the hernial sac, right? So this is regarding if inguinal canal is asked, how you should describe it. Done? Are we clear? Right. Now, the next question here would be on the spermatic cord. As we know, this is one of the important content of the inguinal canal. Now, if spermatic cord is asked, I want you to write it under these headings. Okay. Define what is spermatic cord. Then talk about the coverings. Right. Now, in the coverings, we have the external spermatic fascia, we have the cremastic fascia, and we have the internal spermatic fascia. Know about these three, how they are derived, because this is a very important MCQ for you, right? How the external spermatic fascia is derived. What structure gives rise to external spermatic fascia? What structure gives rise to cremastic fascia? And what gives rise to internal spermatic fascia? A very important MCQ question, right? Then once we describe the coverings, then we need to talk about the contents, right? What are the structures that actually form the spermatic cord? Of course, the most important structure that you should never forget and never miss is the vas deferens, right? Now, without this, your answer is incomplete again. You mention everything else and you don't mention mass difference, again, like it's a incomplete answer. So the first structure all of us should write is the vas difference. Okay, after you write vas difference, talk about the vessels in terms of arteries and veins, and then talk about lymphatics, then talk about the nerves that pass through the spermatic cord. But this is how you should write it. Okay, again, any anatomy question, try to end it with little bit of clinical anatomy. Right. Here you can even talk about vasectomy, right? Now, vasectomy, what is it? Where is it done? We can talk about this if you're talking about spermatic cord, right? Then the other two questions are the inguinal ligament, which is again an important 5-marker. So as I said, this is a very important 10-marker. This is a 3-marker or a 5-marker again. Inguinal triangle, right? This is an important 3-marker question. Okay. If inguinal ligament is asked, again, define what is it, inguinal ligament, then talk about the attachments, right? From where to where the inguinal ligament extends, and then talk about its modifications, right? What are the three extensions that come from the inguinal ligament? What do we mean by ligament of Cooper? What do we mean by the reflected part of inguinal ligament, right? Lacunar ligament, what are these? All of this need to be mentioned, right? Then the inguinal triangle of Hasselbalch, right? Now this is again a very important 3-marker question. What are the boundaries of the Hasselbalch triangle and why is it important? We know that direct inguinal hernia will pass through the Hasselbalch triangle, right? Now, what are the boundaries? What is the medial boundary, lateral boundary, and the base, right? And then how the triangle is divided into two parts. For example, uh, if we consider this as the linea alba, right? So let's imagine we have the linea alba, and on either side of the linea alba, we have the attachment of the rectus abdominis muscle, right? So this is the rectus abdominis muscle. So inguinal triangle is bounded by what structure? So on the medial aspect, we will have the lateral border of the rectus abdominis, and on the lateral side, what do we have? We have the medial umbilical fold, and how this is bounded below? This is bounded below by the inguinal ligament, and how it is divided into two parts by the obliterated umbilical artery. Right. So the inferior epigastric artery, right? So this is what we need to know regarding the Hasselbalch's triangle. What do we mean by the supravesical fossa? What do we mean by the medial inguinal fossa, right? This we need to explain if the Hasselbalch triangle is asked. So please mark this. This could be again a very important 3 marker for your exam, right? The Hasselbalch's triangle. Done? Right. Now, this is regarding the inguinal region. And as I said, you cannot go to your exam without learning the anatomy of the inguinal canal. Done? Right. Then in the male external genital organs, of course, testes, right? Now, this could be a very important 10 marker question for your theory paper. For your practical, this is of course a discussion topic or OSPE topic, right? Testes, again, what it is, right? Where is it located? And then comes the coverings, right? The coverings itself could be an important 3 marker question, right? The coverings of the testes. What are the 3 internal coverings? Then what are the layers that actually make up the scrotum? Okay, this also could be a question, right? Then what about the presenting parts? Then blood supply, uh, lymphatic drainage, nerve supply. One of the most important question that is always tagged with the testis is its development, right? Development of the testis is often a part of the long essay that can be asked, right? How the testis develops and how does it descend? What are the factors controlling the descent of the testis? Why does testis descend? What are the abnormalities of testicular descent? All this comes under development. One more important thing here is when they ask about the blood supply. Remember, in the blood supply, they will particularly ask you about the venous drainage, right? Why? Because the venous drainage of the right and the left testicular vein differs. On the right side, it goes to inferior vena cava, whereas on the left side, it goes to the left renal vein. What is the embryological basis, right? So mark this out. They will ask you about what is the embryological basis behind the venous drainage of the testis. That is, why the testicular vein on the right side? Not just the testicular vein, even the ovarian veins, right? Why the gonadal veins on the right side drain into inferior vena cava? Why do they drain into the left renal vein on the left side? Okay, this is very often asked as a reasoning type of question. So this is one organ in the body where venous drainage becomes more important than the arterial supply. The arterial supply is simple, testicular artery, branch of the abdominal aorta. But more important is its venous drainage, right? Then in the descent of the testis, right? Now, what we need to write in the descent of the testis, just descent of the testis is an important 5 marker question, right? What to write if only descent of the testis is asked. Okay. Now here we can talk about what are the factors associated with descent of the testis, right? How the testis descends. Okay. Then we can talk about the timeline of descent. When does it will reach the deep inguinal ring? When does it traverse the inguinal canal? When it reaches the superficial inguinal ring, and when it reaches the scrotum. Okay. These could be explained in timeline. And then of course, the abnormalities of descent, right? So we can talk about the abnormalities of the testicular descent. This could be one more subheading, right? As I said, a very important 5 marker, right? Now, one more thing in the venous drainage is they will also ask about the varicocele, right? Varicocele could be an important topic for case-based question. What do we mean by varicocele and why it is more common? Why it is more common on the left side, right? Now, again, this could be a reasoning question in the topic of the test test. What is varicocele? Why is it common on the left side? And if it is common on the left side, what is the anatomical basis behind it? Okay, so this could be a very important 3-marker reasoning type of question. Done. So this is regarding the male external genitals, right? Then in the topic of abdominal cavity and the peritoneum, most often we spend a lot of time scratching our heads on the anatomy of the peritoneum and may not end up seeing a lot of questions on peritoneum, right? But there are few questions that are examiner's favorite again. And to pick the first question, I would say I would rank the most important question here would be the anatomy of the lesser sac, right? Now, this is a very important 5-marker question, okay? Lesser sac, and then the epiploic foramen. Okay, now this is a very important 3-marker question. Epiploic foramen, right? Lesser sac, again, if it is asked, what do we mean by lesser sac? Where exactly it is located? Then how exactly it is formed, or we can talk about the boundaries of the lesser sac. Then we can talk about the contents. Of course, it contains peritoneal fluid, and we can talk about the clinical anatomy. We have been stressing from the first episode on the importance of structuring the answer. And if lesser sac is asked, this is how you should answer it. In fact, once we had seen a question where the question was like this. Let's say a 40-year-old patient was brought to the emergency department with a stab wound to the abdomen. The stab wound has penetrated through the posterior wall of the stomach. Which peritoneal cavity is more likely to be entered by the tip of the knife once the posterior wall is pierced? Describe the boundaries, formation, clinical anatomy of this sac or this peritoneal cavity, right? So lesser sac, this is how case-based questions can be framed. Done? Right. So epiploic foramen, simple. Define what is epiploic foramen. Epiploic foramen is also called as what? Foramen of Winslow, right? So you should know this additional terminologies also. The eponyms, right? So foramen of Winslow. Now, what is foramen of Winslow? Then what are the boundaries of the epiploic foramen? And of course, what is the clinical anatomy of the epiploic foramen? These, this is how you should structure your answer if epiploic foramen is asked, right? Now, apart from this, if the examiner wants to make your question paper a little bit tricky, then they can ask about the anatomy of the subphrenic spaces, the 6 spaces which lie beneath the diaphragm. Okay, even in the subphrenic space, one space that they ask very often is the hepatorenal pouch. Okay, so the hepatorenal pouch or the Morrison's pouch, right? Now this will be a very important 3-marker or a 5-marker question for your exam. Okay, all the subphrenic spaces are 5-marker question, but out of this, Morrison pouch itself could be a 3-marker or a 5-marker question. What is it? Where is it located? What are the boundaries? What are the clinical significance? Right. Now, the simple rule is, remember, if it is a 5-marker question, make sure that you have written at least 4 or 5 subheadings for it. Okay, that will really help. Then apart from this, the other questions we often see is question on mesentery, which is a 5-marker. And in mesentery, the structures crossed by the root of mesentery. Okay, now this is a very important question. What are the structures crossed by root of the mesentery? And then what are the contents of the mesentery? Okay, this could be a very important 5 marker or a 3 marker. Apart from this, mesocolon could be a 5 marker or a 3 marker question where you need to talk about both the transverse mesocolon and the sigmoid mesocolon. Okay, then greater and lesser omentum, right? Both of them are important 3 marker question. This doesn't matter whether you read from the chapter of the stomach or from the peritoneum, but these are potential 5 marker questions. Okay. Derivatives of embryological peritoneal folds. For example, dorsal and ventral mesogastrium, right? What are the derivatives of dorsal and ventral mesogastrium? This could be again a very important MCQ topic, right? What structures come from the ventral mesogastrium, right? What structures come from dorsal mesogastrium, right? So could be a 3 marker question or MCQ question, right? So 3 marker or MCQ question. Then examples for, so remember this is like examples, okay? Examples for intraperitoneal, retroperitoneal and subperitoneal organs. And in retroperitoneal, what do we mean by primary and what do we mean by secondary retroperitoneal organs? Okay, this could be a very important MCQ topic. Are we clear? Right? So this is regarding the important questions that can be asked from the chapter of the abdominal cavity and the peritoneum. All right, done. Then what about the next important topic here? So remember, the next important topic here would be stomach, and this is a very important 10 marker question, right? Now, most of the time they will give the headings under which we need to describe the stomach. If it is not given, again, define what it is, mention where it is located, then talk about the parts, right? And when you talk about the parts, talk about the relations. And when we talk about relations of any abdominal organ, remember, we need to discuss under the headings of the peritoneal relations and the visceral relations, right? And in the visceral relation, one more important subtopic would be the stomach bed, right? What do we mean by stomach bed? What are the structures forming stomach bed? Okay, this could be very important. Then blood supply itself is a 5 marker. Then lymphatic drainage itself is a very important 5 marker. Nerve supply itself is an important 5 marker again, right? So stomach is one topic from which we see question almost every year. Could be a main question, could be on stomach bed, could be on lymphatic drainage, could be on blood supply, arterial and venous, but we always see at least one question from stomach every year, right? So this is like a very high yielding chapter in the entire abdomen. Done? Right. Then the stomach bed, as we have discussed, when stomach bed alone is asked, right? Now, what do we need to do is we need to define what is stomach bed, and then we need to talk about what are the structures forming the stomach bed, and then of course the clinical anatomy of it, right? So stomach bed itself, remember, is a very important 5 marker question. As we have said, the blood supply and lymphatic drainage themselves are important 5 marker questions. If you ask me, out of blood supply and lymphatic drainage, what is that? That is more important. Of course, you cannot skip both, but my bet would be on the lymphatic drainage of the stomach, right? Then it is about ligaments and relations of the spleen, right? Spleen as a long essay, I would say unlikely, but ligaments of the spleen, relations of the spleen are potential 5 marker questions. Okay, so what are the 4 important ligaments that are attached to spleen? Like, what is the clinical importance of these ligaments? This could be a very important 5 marker. Then relations of the spleen, both of the diaphragmatic surface and the visceral surface, could be a very important 5 marker again. Done, right? So this is regarding the important questions from the topic of stomach and the spleen, right? Then the next important topics are from liver and extrahepatic biliary apparatus. Liver itself could be an important main question, but if you think about stomach, duodenum, then possibly kidney, inguinal canal, rectus sheath, this again comes a little bit lower down, but could be a potential long essay, right? No question about it. But the most important questions in the topic of liver, I would say, is about non-peritoneal relations of the liver, right? What are the non-peritoneal areas of the liver, which are otherwise called as the bare areas of the liver, right? Then in the bare areas of the liver, there is one large non-peritoneal area which is called as the bare area of the liver. Now, both of these will be important 5-marker questions. In the non-peritoneal areas or bare areas of the liver, what you need to define is, you need to define what are bare areas of the liver. You need to list what are the bare areas of the liver that we have, and then maybe talk a little bit about the clinical anatomy, right? If bare area of the liver is asked, again, you define what is bare area, then talk about the boundaries, right? What are the boundaries of the bare areas of the liver? And then talk about the clinical anatomy. And in the clinical anatomy, always there is a correlation about the portocaval anastomosis, right? Portocaval anastomosis is one thing that you want to mention as one of the important clinical anatomy of the bare area of the liver, right? Extrahepatic biliary apparatus. This is a very important main question, 10 marker, right? Most of the time in extrahepatic biliary apparatus, what they usually ask is, right? They ask about the classification or more commonly what I would call as parts or components. What are the components of the extrahepatic biliary apparatus? We need to list down the components starting from the like the gallbladder, cystic duct, right and left hepatic duct, the common hepatic duct, common bile duct, everything, right? So what are the components? And the sub question would be on the anatomy of the gallbladder. We had seen the gallbladder being asked as a 10 marker question, the anatomy. And then the most common part in this would be the common bile duct. Okay. So the most important question here would be the anatomy of common bile duct rather than the anatomy of the gallbladder. Done? Right. So this is regarding extrahepatic biliary apparatus. Uh, Again, most often students tend to skip it, but a very risky topic, right? A very important topic for your exams that you should never think of skipping, right? Then in this, the Callet triangle. Okay, this could be a very important 3-marker question. What do we mean by Callet triangle? Or what do we mean by the cystohepatic triangle? What are the boundaries? What is its content? Right? In liver, one more question I would suggest you to prepare is from histology, right? Histology of the liver. Of course, we will have a separate session on histology, right? Histology of the liver. Then in the histology of the liver, what do we mean by the portal lobule? This is a very important 5-marker question, right? Histology of the liver. In that, portal lobule and the hepatic acinus. What exactly they are and what is its clinical importance? So this often will be a 3-marker question. Okay. So portal lobule and hepatic veins, these could be 3-marker questions. Done? Right. So this is regarding the topic of the liver, right? Now, in this topic itself, portal vein, portocaval anastomosis, we'll come and discuss about that also. So portal vein, portocaval anastomosis are 2 more important topics that you should be prepared for. right? So this is regarding liver and extrahepatic biliary apparatus. Then in the topic of duodenum, of course, this is a 10 marker, right? No question. Duodenum is a 10 marker. Even in this, my money would be on the second part of duodenum, right? Very favorite topic of examiners again. Most of them tend to ask about like list the parts of the duodenum, define the parts of the duodenum, and describe the second part of the duodenum in detail. That's how the question is usually framed. So ensure that you have gone through the details of the second part, right? Then one more important question here is the interior of the duodenum. Again, even in this, it is interior of the second part, right? Again, a very important 5 marker or a 3 marker question, right? So again, in abdomen, duodenum, stomach, two very vital long essays that you should be prepared for, right? In the duodenum, right? Uh, just forget this typo. So this is regarding the blood supply of the duodenum, right? So this again is a very important 5 marker question, especially the blood supply of the second part, because it's supplied both by the branches of the celiac trunk as well as the superior mesenteric artery, because that's where we have the embryological junction between the midgut and the foregut, right? Pancreas, a very important 10 marker question. Then again, in the entire abdomen, two questions that we keep seeing, right? We keep always seeing are from the development of the pancreas and histology of the pancreas. In general histology, one question that we have seen most often is the histology of lymph node, right? In case of the abdomen, two questions that we have very commonly seen are from histology of the liver and then histology of pancreas, right? Very important, right? So be prepared for these. Development of the pancreas, a very important 5 marker question. If you are talking about paper one where we have thorax, right? Development of right atrium is very commonly asked. Development of interatrial septum is very commonly asked. So this development of the pancreas is as common as these development of heart related question, right? Then the portal vein, as we discussed in the previous slide itself, this is like a very important topic for your exam, right? Potential 10 marker question, right? Define portal vein, mention its formation, termination, tributaries, and area of drainage, and then portocaval anastomosis. Now, in portocaval anastomosis, remember, we need to remember about 5 to 6 sites, but what we need to remember in this is like where exactly the portocaval anastomosis is present and what systemic veins, right? What systemic veins and what portal veins or tributaries meet. This is a must, right? Most often we would have seen portocaval anastomosis as a long essay, and we go with the feeling that, okay, I have seen this question enough number of times. I know what to write if portocaval anastomosis is asked. But what we tend to forget is one of the answers that we tend to forget is what are the tributaries of the systemic vein that meet at that site? What are the tributaries of the portal vein that meet at this site? This is where most of us will go wrong. Okay. And remember, this is one topic each and every examiner will be thorough with, right? So you can never bluff with them, right? So read about portal vein, portocaval anastomosis thoroughly, right? Again, this is one question that is like very often repeated in this paper of abdomen and pelvis, right? Done. Then regarding the other parts of the GIT, small intestine, large intestine, mesentery we have talked about when we discussed about the peritoneum. The comparison of duodenum, jejunum and ileum, right? This could be a very important 5 marker question. How do we differentiate between duodenum and rest of the small intestine. Then how do we differentiate between the duodenum and, I'm sorry, how do we differentiate between the small and the large intestine, right? This could be a very important 5 marker again. So all these questions, 5 markers. Okay. Cecum appendix could be 10 marker questions. You never know. Or very frequently asked as 5 marker question. Okay. In vermiform appendix, especially the positions, right? The positions of tip of the vermiform appendix, very important. In cecum, type, and my money is on, again, the posterior relations of the cecum, right? This is what is often ignored by the students, and this is like a favorite topic for your paper setters. Even when you go to your gross anatomy practical, they will set questions on uh, identification of structures related to the posterior surface of the cecum. Okay. Then in the cecum itself, they can ask you about the arterial supply of the cecum, and same with vermiform appendix. What is the blood supply of the vermiform appendix? And related to vermiform appendix, they can ask you about the McBurney's point, right? Now, what is McBurney's point, right? Define it. How do you mark the McBurney's point? What is the clinical significance of McBurney's point? And then in the vermiform appendix, they can also ask you about the anatomical basis for pain in acute appendicitis. Remember, pain in acute appendicitis initially begins around the umbilicus. The pain is periumbilical. Later on, it gets localized to the right iliac fossa where we have the appendix. What is the anatomical basis behind this, right? This is again a very favorite question, clinical based question, reasoning question that can be asked. Okay. Anatomical basis for shifting of the pain in acute appendicitis from the periumbilical region to the right iliac fossa. Done. In the large intestine, the other question you can expect is on marginal artery of Drummond. How the marginal artery of Drummond is formed? What are the two arteries that form it? And in the blood vessels of the intestine, again, remember, we can get questions on the superior mesenteric artery and inferior mesenteric artery, both of which are very important 5 marker questions, right? We would again tell about this when we talk about the posterior abdominal wall, but these are the 2 questions that I want you to be prepared with. Okay. Superior mesenteric artery, inferior mesenteric artery, and also the artery of the foregut, that is celiac trunk. Right? Done. Then in the kidney, ureter, and suprarenal gland, again, my money is on kidney, could be important, a 10 marker question. More important than being asked as a 10 marker question, very important for your practical exam also, so you cannot skip this. In kidneys, more than the entire kidney being asked, these are the 2 topics that are very often asked as 5 marker questions. Relations of the kidney, again, anterior, posterior. Kidneys are retroperitoneal organs, period, right? Then what are the anterior relations and posterior relations? In both, we need to talk about right and left. Right and left. So, easier way, draw a diagram, right? And when you draw the diagram, okay, always again try to let the examiner know that you know little bit more about the kidneys. So make sure that you show the kidneys in different planes. The right kidney lower, the left kidney higher. Okay. Mark the relations by showing it on the diagram itself. Okay. What are the 5 structures related here? What are the 6 structures related anteriorly to right and left kidney? Then posterior relations. Of course, everything is common except for the 11th rep, which is related to the left kidney posterior surface. Right. Macroscopic structure. If the examiner wants to make it a little bit on like moderately difficult side, little bit tougher side, they can ask about macroscopic structure. But again, everything about kidney is important for your practical exam, so you cannot skip it. Macroscopic structure. Now, when you're reading this, also please go through about the histology of the kidney. And in the histology, please make sure that you have gone through the juxtaglomerular apparatus, right? Juxtaglomerular apparatus. Histology itself is a 5-marker. This is a very important 3-marker question. Okay, juxtaglomerular apparatus. What components form it and what is its function? Then thoracolumbar fascia. What is it? Right? What are the layers of thoracolumbar fascia? What are the parts of thoracolumbar fascia? What about the attachments? And then what about its clinical anatomy? A very important 5-marker again, right? In ureter, a 10-marker question, very unlikely, but relations, right? Relations could be a very important 5-marker question. In the relations, remember, we have got two parts, abdominal and the pelvic part of the ureter. And most often, they will be asking you about the relations of the pelvic part. And when they ask about pelvic part, again, we make a mistake in remembering the relations or representing the answer. Whenever pelvis comes, male, female, you have to talk. Any pelvic organ, male, female. Of course, except uterus, right? So this is how we should describe the ureter. In ureter, one more question that is very frequently asked is the question on constrictions of the ureter, right? A very important 3-marker question, right? What are the levels at which the ureteric constrictions are found, right? 3-marker. Remember, constrictions of the ureter are embryological and they are not anatomical. These constrictions are developmental and not embryological. My suggestion, when you begin the answer, write this as the first line. The ureteric constrictions are embryological or developmental in origin and they are not anatomical. This itself might impress the examiner and they may not even look at what you have written below, right? So first line, write this and then talk about the 4 constrictions and where they are present. Done. Suprarenal gland, again, my money is on the blood supply. Okay. Blood supply of the suprarenal gland, and more important than that, I would say histology. Right? Very rarely you can get question on the development. Right? And this is more likely to be an MCQ. Right? An MCQ on the development of the suprarenal gland. How the cortex develops, how the medulla develops. This could be a very important 3-marker or a very important MCQ question for you. Done? Right. Then the next and possibly the last important chapter in abdomen. Of course, we are not doing pelvis today. So in the topic of the posterior abdominal wall, again, my money is on the abdomen aorta and its branches, right? And in the branches, the celiac trunk, the superior mesenteric artery, and then the inferior mesenteric artery. Other arteries, less likely, but we can see a lot of questions on these 3 arteries, right? All are important 5-marker questions. Inferior vena cava, a 5-marker question. Psoas major, 5-marker. Psoas sheath, a 5-marker. Again, if the examiner wants to make it very tough, they can ask question on psoas sheath. Why I'm talking about psoas sheath is your competencies, right? Your competency book specifically mentions about the psoas abscess, right? What is the anatomical basis behind psoas abscess is a very important 3-marker question, right? So you need to be prepared with this. Done? I've not gone in to discuss any of the topics from abdomen as such, but we have spent a lot of time trying to understand what questions have been asked and how to approach these questions. Now, before we close the session today, let's try to see some actual questions that are asked, right? Just to tell you that, like, all this while we were not bluffing and we were actually talking facts, right? Now, these are some of the questions that we had from the topic of abdomen, from the chapter of abdomen, right? So you can see a question on duodenum, right? Again, if you observe blood supply, right? Development. Why they particularly ask about duodenum as duodenum develops from both from foregut and midgut. Like they want to check it again and again. That's why they ask about interior. That's why they ask about blood supply. That's why they ask about development. Right? Then, apart from this, the inguinal canal, as we discussed, boundaries, contents, the defense mechanisms to maintain the integrity of the canal, applied anatomy, talk about inguinal hernia, direct, indirect, define what they are, and mention about how do you differentiate between the two hernia based on the coverings, right? Again and again, I'm repeating this. Distinction or differentiation of the hernia based on its coverings. Very important, right? Then, uh, there is one question here. A 68-year-old female presented with increased frequency of micturition. What do we call it as? We usually refer it to as the polyuria, right? Then there is polydipsia. What do we mean by polydipsia? Increased thirst, right? Then she was diagnosed with diabetes mellitus. See, this is what I said. The diagnosis is like most likely to be given in anatomy. Name the organ which secretes insulin. Can you expect an easier question than this? Right? Pancreas. And talk about the relations, blood supply, parts of the organ, right? Every time a case-based question is asked, like there is no need to get scared of the question, right? See this question, name the organ that secretes insulin. As simple as that, right? Of course, we may not get such simpler question in exams, right? But what I'm trying to suggest is case-based questions are not always difficult. You need to just apply your mind and think about what is the organ that the examiner is trying to ask and just describe the anatomy. Done? Right. Then other questions. Again, long essays, all long essays as we can see. See here, a 30-year-old man came with a history of upper abdominal pain and vomiting. On examination, there is tenderness, right? There is pain on like palpating, right? So tenderness in the epigastric region was noted. Now, which organ is involved? This is why we should know about the location of the organs. If it is left hypochondrium, it is more likely to be the examiner is asking about the spleen. If it is right hypochondrium, the examiner is asking about liver. If it is epigastrium, what the examiner is trying to find out, he's trying to ask about the stomach, right? So this is about the stomach, its external features, peritoneal, visceral relations, blood supply. Questions like this is where you need to be very careful. Okay. Here, if you get this question wrong, right, your entire answer will go wrong. Okay. So that first question, which leads to what is that organ that the examiner is trying to ask, this is something that you should not miss. Right? Okay. Then, again, a case-based question, as we can see. 12-year-old boy brought to casualty with complaints of fever, vomiting, and periumbilical abdominal pain. Please focus on this. Periumbilical abdominal pain. On examination, his abdomen was rigid and there was a tenderness at the McBurney's point. Right? As I said, this could be a 3-marker, I told you. Right? McBurney's point. Now, name the parts and peritoneal folds the organ likely to be affected in this boy. Organ affected is what? Vermiform appendix. You need to talk about its parts. Base, then we have the body, then we have the tip. Right? Then, what are the various positions of the organ? Positions of the organ with reference to the tip. That 12 o'clock, 2 o'clock, 3 o'clock, 4, 6, 11 o'clock. What are these anatomically referred to as? Then where is McBurney's point? Describe the blood supply and microscopic structure of the organ affected. So remember here, as I said, vermiform appendix like could come more or likely to be as a 5-marker question. But what they have done here is they have clubbed it with histology. Okay, so this is how the abdominal organ questions are often asked, either development or they will ask you about the histology, right? So one more important thing I would suggest is before you start solving the question, always take a look at like how many marks have been allotted to each sub question. Okay. here it is about name the parts. Just name the parts. That's it. Okay. Then peritoneal folds of the organ. They have not asked you to describe the peritoneal folds of the appendix. Neither they have asked you to describe the parts of the appendix. They have just asked name the parts. Name, list, mention, enumerate. Just name them and keep quiet. Describe, explain, discuss it in detail. Right? Then one more question I wanted to show you before we end the session is this question. Draw a neat label diagram to show components of extrahepatic biliary apparatus. Again, a 10 marker question, right? Now, here observe, I told you more likely they are, most likely they will ask about common bile duct. But if you just observe here, what they have asked here, they have asked about the anatomy of the gallbladder. Right. Again, more often, what do we think? Gallbladder could be a 5 marker and we may leave it out. But remember, even gallbladder can be asked as a long essay. Now, this is why you need to go through the PYQs. Okay. Again, if you're planning to give your internal assessment, if you're planning to give your exams without looking at previous year question papers, it's a crime again, right? If you have a chance to collect the previous internal exam papers, previous exam question papers is a must, of course. But even if you can collect previous internal assessment papers, nothing like it, okay? This will actually tell you the mindset of your own examiners, your own internal examiners, what they are asking every year in internal assessment, what questions are like most frequently coming in the university exams. So please focus on them first before reading anything new, right? This would solve most of your problems, right? Over the last 1 hour, 10 minutes, we have tried to discuss extensively like what topics can come and how to approach if these topics can come in your exams or internal exams or in your university exams, right? If you have any question, if you have any question related to whatever we have discussed till now, you can let me know before we close. I'll try to solve it. Or otherwise, we will end the session. I'll wait for like a couple of minutes if there are any questions, and then we will close it. Hi Aditya. I had not seen your question. I'm really sorry, but I will like post a video, a link where we have discussed like how to differentiate between the male and female pelvis. And I believe like if you have access to the DocTutorials app, we have discussed like all these practical osteology related sessions in detail. Fine. So just try to explore the app. We have the like all the practical videos there, but I'll still share a link with you so that like you can actually go through like how to differentiate between male and female pelvis, right? Once again, I thank you all for attending this session. All the best if your internals is coming up or if you have your exams coming up, right? We will meet again next week, and next week we will focus on the section of the pelvis, right? So again, a lot of questions can come from pelvis, and next week we'll try to focus on the topic of the pelvis, and we will start on the same time again, 6:30, and in 1 hour we'll try to discuss all the important topics of the pelvis, right? Thank you.